Mr. Chairman, thank you very much for the hearing, and I want to thank our witnesses for their public service. Mr. Chairman, let me start with Dr. Hahn, then I'll move to Admiral Giroir. Dr. Hahn, I wanted to ask you about vaccines, and as your testimony indicates, and as we've been discussing over time, as researchers work to develop vaccines to protect against COVID-19, it's important that the final FDA-approved products have the full confidence of the American people. A vaccine doesn't help if people don't choose to, in fact, be vaccinated. So my first question is, given that we've seen very high rates of both vaccine refusal as well as skepticism, what role can the FDA play in the coming months to earn the public's trust that the COVID-19 vaccines are safe and effective? That's question number one, what role the FDA can play. And then the second question is, what steps can you take as FDA commissioner to bolster public confidence?
Thank you, Senator, for that question. I couldn't agree more that public confidence in vaccines is so important. So to your first question, we have an obligation to use all of our scientific knowledge, our regulatory framework, to ensure that any vaccine that comes before us, whether for authorization or approval, meets our stringent standards for safety and effectiveness. One of the reasons that we issued that guidance that I mentioned in my opening statement was to provide regulatory clarity around what FDA expects with respect to those data. We want to see certain parts of those data so that we can demonstrate to the world, to the nation, to the American people, that we are following our rigorous standards with respect to safety and efficacy. The other thing that we've done is draw a very bright line between FDA and our regulatory independence and all the sponsors who are putting forth vaccine applications to us. And that includes Operation Warp Speed. So we are providing technical assistance to those sponsors, but we are not part of the decision-making process, and we will maintain our regulatory independence. I will not prejudge, the agency will not prejudge any decision with respect to this, but we will use the science and the data. With respect to what I can do personally, Senator, I commit to you that I will continue to be a voice emphasizing the regulatory independence. We have a number of communications in progress to communicate to the American people that the standards we're going to uphold are firm, they are rooted in science and data, and that they will ensure that we meet the usual high standards of FDA with respect to safety and efficacy.
Thanks very much, Doctor. I might submit a question for the record to Dr. Redfield as well, but just so I can get my second question in to the Admiral. Admiral, I want to ask you about testing and insurance coverage. Testing, as you know, and as we've emphasized in these hearings, is so fundamental in order to prevent the spread of COVID-19. Congress, I think, acted upon that knowledge by mandating full coverage of COVID-19 diagnostic and antibody testing, both in the Families First bill as well as the CARES Act. We made it clear that Americans shouldn't have to pay a dime for COVID-19 testing. But we're hearing alarming reports of people not being tested often for one of two reasons, because they're under the impression they will have to pay for testing, and patients who have been tested are receiving surprise medical bills. The administration has issued guidance that appears to be in conflict with congressional intent and public health guidance, and so we have some confusion here. I'd ask you, Admiral, can you assure the American people that the Department of Health and Human Services will fulfill the intent of both the Families First bill and the CARES Act and ensure that the American people will be provided wide access to COVID-19 tests without cost or limitation?
So thank you, Senator, and I want to thank all of you for emphasizing the importance of testing and eliminating any barriers that there could be. I can't speak for the department. I certainly speak as the Assistant Secretary and as the testing person that we firmly believe and support the concept of no-cost testing. There should not be a disincentive in any single way to get the diagnostic test that you need, to get tested during screening or the serology test as Congress intended. So thank you for that. We do need to keep getting that message out. It's a very important one to have.
Thank you, Admiral. Thank you, Mr. Chairman.
Thank you, Senator Casey.